I want to start by introducing myself. I'm Caitlin D. Clerk, along with my colleague and friend, Dr. Mohammed Garipur. I'm one of the co-founders of the Epidemic Urbanism Initiative, and just wanted to spend a minute to first of all say thank you all so much for your work and for being part of our inaugural offering of these Epidemic Urbanism Initiative workshops. This is the first time we have offered these, and we've been really thrilled to see so much enthusiasm and interest in this community. We also appreciate all the work that you did to prepare for today. So again, thank you for your time. As you know, we are about ready to embark upon module 3 of this Epidemic Urbanism series of workshops. And this afternoon or this evening, wherever you are in the globe, we're going to be talking about architecture. Before we begin, though, I did want to just give a really brief introduction to the Epidemic Urbanism Initiative. As you may know, the Epidemic Urbanism Initiative was founded in March 2020 in the height of the COVID-19 pandemic. And since that time, we've really developed the initiative into an educational hub really centered on urban health and equity in response to a range of sort of crises such as the COVID-19 pandemic and many more. As part of this work, we have organized a series of international symposia exploring a range of topics from architectural history to design to education, et cetera, all really centered on these ideas of urban epidemics, urban health, and urban inequities, and sort of what do we do next, right? Well, how do we learn from all these experiences? We also have published a book that you see here. It's an edited volume called Epidemic Urbanism, Contagious Diseases in Global Cities. And something we are particularly proud of as part of this initiative is that we have established a network of liaisons who represent 78 countries across the world. And the faculty that are going to be doing today's presentations are members of this community. So we're really grateful for them to be able to help shape the initiative to ensure that our activities are meaningful within the various countries across the globe, and to, again, lead conversations like that we're going to have today. If you're interested in learning more, we do invite you to look at our website, epidemicurbanism.com. Please also know that all conversations that we convene as part of the Epidemic Urbanism Initiative are recorded and made publicly accessible on our YouTube channel. So if you want to use these as educational tools, if you're teaching a course, or if you're a student and simply just want to learn more, we do encourage you to look for recordings of all of these workshops, as well as all of the other conversations that we've organized over the last 2 years on our YouTube channel. Please also feel free to contact us with questions or suggestions at any time. Our email address is on this screen. I should also note that as a thanks for your participation in today's module, we will be sending each of you certificates of participation. So please look out for that in the next couple of weeks. So with all those logistical points underway, it is my pleasure to now introduce our speakers for Module 3. First, I'd like to introduce Dr. Oliver Sukrow, who will be leading a lecture today on hospitals. He is currently a postdoctoral scholar at the Research Unit Art History at the Technical University in Vienna, Austria. His main research areas are socialist architectural heritage and the history and medias of landscapes and architectures of health since the 19th century in Central Europe. Next, Dr. Adam Nadolny will be lecturing on salutogenic architecture. Adam Nadolny is Associate Professor in the History of Architecture at Poznan University of Technology and part of the Faculty of Architecture in the Division of History, Theory, and Heritage. He's also the coordinator of the International Cooperation in English Language Studies. And finally, one of our speakers who planned to be here today is Dr. Katarina Angelkovic. It is possible she will not be able to join us today, unfortunately, but I did want to recognize her efforts by reading her bio, and hopefully she will be able to be here later on today. So Dr. Katarina Angelkovic will be planned to talk about collective housing. She's a theorist, practicing architect, researcher, and a painter, and has served as a visiting professor at the University of Oklahoma in the United States of America, the Institute of Urbanism and Landscape in Oslo, and also at the University of Belgrade. She is author of the Preliminary Architectural Design, a national project supported by the government of Serbia. And now, with these logistical points and these introductions to our fabulous speakers underway, it is now my pleasure to hand the microphone over to Adam.
Thank you very much, Catherine, for the invitation. So, okay. I would like to start my presentation. So, ladies and gentlemen, thank you very much for joining us. Okay, the official title of my presentation is dedicated to the salutogenic architecture, but I would like to return a little bit to my my practice to some points which are quite interesting. So here on this slide, you can see some of the answers you sent to us during the preparation of this workshop. So I really appreciate of this, and so I would like to start from this, and I would like to end with these questions, because I think that each of these questions can be maybe the question, the answers. Each of these answers can be treated as some kind of invitation to the discussion. The discussion will take place later, I hope. But I think, as you can see here, each of you, some of you, of course, choose the topic as a salutogenic architecture as some kind of way of demonstrating the idea how the healthy cities should look like, how the cities should be developed, how the pandemic ideas were split among the different areas. I would like to concentrate on these three important parts a little bit later. But of course, probably the most of you should remember this World Health Organization sentence, what the healthy city is in general. Because of course we should remember that this healthy city, it's not only the city where we can live without any problems, without any sorrows, etc., etc., but also this is the city, how the city should be designed, how the city should be redesigned, because of course, as you remember, the history of the cities, it's an ongoing process. Yes, as Shakespeare said, that the people are the city. It's of course it's obvious. We should also remember that these elements we can produce here are very important. Of course, the urban planning, the public spaces, greenery, transport system, etc., etc. All these elements are important, but of course, this element connected with the healthy ideas is very important, because if we would like to do something with the pandemic in the future, I think we should also look a little bit deeper. I would like to present the project, which was I was a guest professor at one of the universities in Poland, together with my colleagues from the PhD school and the Polish students. We've been searching for the idea what this healthy city should be in reference to the pandemic time. It was as you can see, we are still in the dip of the pandemic. It's the year 2021. Why I'm presenting this project? Because I believe that without the promotion of the knowledge among the students, among the promotion of the healthy cities ideas among the people who will be the professional town planners, who will be the members of the local administration, these elements cannot exist. Of course, we start from the beginning. This is a little part of the city of Gdańsk. The city of Gdańsk is one of the biggest harbor cities in Poland. And what we can find, because this is a city with a very rich history, and this area, the area located not so far from the harbor, it is the mixture between the architecture coming from the socialist period, especially the panel technology objects, some little greenery, and of course the place and places which are treated by the locals as accessibility for example, to the nature, to the landscape, especially to the sea. Here we made some kind of basic research. The basic research is very important, as you remember. And referring to your answers, I would like to present some other elements. Of course, we try to talk about the sun, earth, and other things which are also important as elements for healthy cities. But I think this general condition was also based on searching for the temperature, how the temperature will change, how these places can be redeveloped in the future. But of course, the internal loads and some other elements are also important. Okay, this is just a beginning, just some kind of introduction. How can we do this, and how can we inform the inhabitants how their, let's say, the special life will look like in the future. Of course, we should also remember about these elements which are also quite important in the contemporary times: the sun, the solar load, some kind of thermal, high thermal mass, etc., etc. All these elements we treat as an introduction to for the searching the idea how this place should look like. Of course, when you ask people, probably sometimes you ask yourself too, what is the what a healthy city is in general. How can we define this? Of course, we can try to find several answers. So here I would like to present some few points. Especially, we can talk about the natural and the green cities. Yes, of course, we talk about the green roof, etc., the green corridors, and some other elements. Of course, we can also talk about some spaces for integrational conventionality. It's also a very important element, which also give us a possibility to find the answers. And of course, the cities for walking. Yes, the city for walking as a places where we can easily navigate, when we can meet the people. But of course, as we remember from the let's say for the heavy pandemic time, this accessible for the open spaces was quite difficult because thanks to the correlation between people, the virus was spreading. And of course, the urban health indicators. We choose the area and we start to look what we have at the beginning. Cities for walking. This is what we found, analyzing the area, and this is what we did. It means we change. Okay, maybe we don't change totally everything as a general idea, but of course we try to answer the question how this healthy idea can be spread among the people through the urban planning, architecture, and some speaking through like a public relation, in fact, because sometimes we know this very well that. Sometimes it's quite difficult to if we don't produce the idea, if we don't sell this idea among the people. Sometimes it's quite difficult to explain them how it's difficult to explain them how this idea should follow. Of course, we start from the beginning, from the very simple analysis. Of course, we can also try to have a look at the general ideas. So we found so many interesting areas. We can find some places which comes from the communist period. So it means that we have a panel technology buildings which are not so very, let's say, not maybe important, but they are quite not very popular among the people. In fact, we can talk about the people, what the people can choose, how the people can work, and how the people can split the ideas. Of course, so what we can, I'm sorry, so I have to, okay. So what we can, I would like to change the slides, so I stop. Jesus, I'm stuck with my slides. I don't know what happened right now. Oh no, what should I do right now? I'm sorry, maybe I will come back just in a few seconds. All right, so yeah, okay, now it's working. Okay, so first we can also try to add some kind of bike paths and some kind of connections, how the people can connect each other, how they can build the atmosphere of the place. The green vision is so important. So of course we should also remember that this green vision always bring us some kind of positive feelings, and it give us a possibility to build up the structures of places. And of course, here we can find what we can offer. How can we offer the new possibilities for people? How can we build up the structures? How can we find the connections between the water? How can we change the existing function? Of course, the student used to try to answer the questions: how the public spaces should look like, how the public spaces should be developed. So of course, if you have a look at the right side, you can find the current situation. So it means that we have so many empty and abandoned places which can be used as some kind of gates into the, let's say, the healthy city for the future. We can also talk about some kind of biodiversity, some new communication, some places which the places who can give us a possibility to live in a much more interesting condition in general. And of course, we also try to come back to the water reservoirs. So it means that we try to come back to the nature. We try to come back to we used to try to use the wind for the much more healthy ideas. In fact, in general, but of course, the problem we can find here is just how can we introduce the people? How can we introduce the inhabitants into the general idea of the healthy city? How this healthy city can be defined by inhabitants? How this healthy city can be defined by by local authorities. In fact, the students together with my students, we used to try to rebuild these areas, but of course using a very simple simple steps or simple tricks maybe. So adding the greenery, presenting or showing to the people that of course this accessibility to the public spaces is very important, because thanks to these public spaces the areas can be treated as a much more healthy city environment, in fact. But of course, this is the way of treating these young people is very important. The treating how they have to be treated, how they have to be educated. In fact, in general, we also have the nursing home, but of course, it's also the part of the university hospital, which is located nearby. I think that Oliver will explore this topic more, but I just also would like to point out that we also had a hospital in our project. Of course, if you coming back to the questions, so I think I would like to come back to this question, to this some short sentences during the conversation. But I think that especially when we have a look at this one, which is presenting the very interesting idea that thanks to the pandemic, people start to believe that the houses should change, their environment should change, because they for many years they were expecting, for example, if we built up something from the concrete, it would be fantastic. Yes, I also have my office in Poland. I also have a fantastic concrete wall. It looks amazing. I can take photos, but it's not the main point. The main point is that the people start to search for some new alternatives, some new ideas how to live in a very much more healthy surroundings. And of course, this choosing parts from your answers were very interesting and very fruitful of ideas. I think that we would like to come back to this part during our discussion. Thank you very much for your attention. I hope I'm in time. This graphical presentation help us. I hope that this graphical presentation will help you to understand that this salutogenic architecture can be also treated as a part of the education. And without this, we cannot talk about the healthy city and to let's say some kind of fighting with the pandemic for the future. Thank you very much.
Thank you so much, Adam. And next we will turn to Dr. Oliver.
All right. You see my presentation?
Yes.
Perfect. Thank you, Adam. Thank you very much for your notion of the healthy city, because this will be also important in my presentation. And thank you very much, Caitlin and Mohammed, for organizing this amazing workshop, and welcome to all the participants to our panel that is dealing with the relation of architecture and health in a very broad sense. I want to share with you some thoughts and images for our discussion on architecture and planning the healthy city. And since I'm trained as an art historian, I will start with some more ancient examples before we move on the timeline. I think that the last 2 or 3 years have significantly shown the role that spaces and places of health play within our societies. During the ongoing global pandemic, places and spaces of health have become more and more also social spaces. And the lack of sufficient spaces and places of health reveal the ongoing and systematic problems that we as a global society, I think, have to tackle in terms of access to health and well-being. So in my presentation, I will focus on just 2 aspects. This is because of the very limited time. But I think that these 2 aspects I'm going to talk about might be inspirational, or at least thought-provoking for you as becoming architects and planners that maybe at some point in your career will also have to design and create spaces and places of health. But before I come to my 2 points, I would briefly like to mention the fact that health as a term is a highly flexible and tangible word. That is why the World Health Organization, WHO, describes the concept of health as related to time and space as well as in a cultural perspective. So healthy does not only mean the sheer absence of illness, but it also means like spiritual, mental, bodily, and physical well-being. That is why it seems important to me to stress the fact that spaces and places of health should be more than machines for healing, and that they should provide more to community than just curing. Instead, spaces and places of health, hospitals, for example, are communal, social, and in a way, cultural centers that reveal what people at a specific place and in a very specific time thought about concepts of health and well-being, sickness and illness, curing and healing. I think that this open and flexible idea of health as being more than not sick is also very important for any planning and designing of places and spaces that address health and well-being. But back to my two main points for today's panel. As an historian, I'm especially interested in the intentional creation of spaces and places for health and well-being. So in what ways and forms did people develop spaces and places that face the challenges of illness and diseases? And how were those spaces and places designed, decorated, and embedded in contexts? That is my first point. And the second point I would like to underline today is that spaces and places of health were not necessarily architectures, but often included landscape, the environment, or nature. That means that beyond the specific design of architecture, the environment and the creation of a link between architecture and landscape played a major role in historic concepts of health and well-being. So I would like to show you, all right, this is a definition of hospital that like covers this. It's something that is built, not necessarily, I think, but it's built, and it follows and has to fulfill different functions. I would like to show you an example that I also use in my teaching of architecture students at the Technical University of Vienna to make these 2 points that I was mentioning maybe more clearer for you. So what we see here is the so-called Asklepion, it's a Greek word, on the island of Kos in Greece. It's a digital reconstruction of the area. It was built around the year 100 and was used for different kinds of treatments, procedures, and also worships. The ancient Greek concept of health was in a way, I would say, modern, because it included the body and the mind. And for both the body and the mind, specific spaces and places were designed in the Asklepion. The Asklepion was a mixture of temples, assembly halls, open spaces, courtyards, staircases, gardens, and communal spaces in which the patients receive treatment from the priests or the doctors. It's hard to distinguish. This would cover the first point, specifically designed and designated spaces and places of health. But there is another quality that we should recognize. Look at this fantastic view of the landscape from the steps of the Asklepion. Landscape, nature, and environment were intentionally incorporated in this whole concept. So this covers my second point. The environment is linked to the architecture on 2 levels, physically, because you have to climb the stairs to enjoy the view, and also emotionally, because you can enjoy the view, you breathe the fresh air. So it's a very holistic concept of health, I would say. The ancient Greek Asklepion might teach important lessons also for contemporary planning of hospitals, I think. Just a side note, the idea that the environment should be incorporated and linked to architecture and urban planning and to designated spaces and places of health become once more very relevant in the 19th century when the spa town or the health resort was established. You can see this on this map of a typical spa town of the 19th century. This is Baden-Baden in Germany. And you see on the map how nature and city are entangled and how the landscape was made accessible and also enjoyable with pathways, bridges, viewpoints, and pavilions. This is what we can call a landscape of health or therapeutic landscape. But let's get back to the aspect of architectural history and design. I want to show you 2 examples of historic hospital architecture that I'm dealing with in my research. Although they are historic examples, I think we could trace the influence also in today. All right. The first picture you see is the historic general hospital in Vienna. It was built in the 18th century and was commissioned directly by the Austrian emperor. As you can see, it is a system of courtyards that are framed with rectangular buildings. The architecture shows, I would say, a monumental style. It is very geometrically, it is very ordered, and somehow also abstract or systematic in a way. The patients were treated in the buildings you see, and they used the courtyards for work, for gardening, and for walking. This kind of hospital architecture is called the corridor system, and rooms are linked to a central pathway, which makes them easily accessible. And I think a lot of you might know this image of a hospital and this idea of a long corridor with the rooms going to the left and to the right. The second example is totally different, but it's also in Vienna. It was built around 1900, so roughly 200 years later than the first one. And I think we can all agree on the first glimpse that there are a lot of differences. Here we have a park with buildings that served as pavilions for treatment, for administration, and so on. Although there is a central axis recognizable in the area, the whole topography has a very different atmosphere. It looks like a bit of a garden city, I would say. The typology here is called pavilion system, which means that every unit is independent from another. The pavilions are linked with streets, but separated from each other. This pavilion system was developed to face diseases that spread from patient to patient. So the pavilion system provides isolation and is useful for contagious diseases. To summarize my talk, I tried to show you how architectural history might inform us and might provide inspiration for contemporary spaces and places of health. I don't think that there is an universal model or blueprint for hospital architecture. And I think that concepts have to be site-specific and have to include also local knowledge. It is necessary to observe and evaluate the local climate, the topography of the site, to study the local materials, make historical analysis of the place, and also empirical observations of the conditions. While international modernism pushed for a long time a universal model of hospital architecture as machines for healing, I think that the architectural history provides a very rich reservoir or pool of ideas and concepts that are up to re-evaluation. So my question to you, the audience, would be, based on the things that I have said, can we constructively overcome the machines for healing? For example, by creatively anticipating and recognizing historical roots of hospital architecture. I'm very much looking forward to your ideas and thoughts, and thank you for your patience.
Okay, so we have one question. Yeah, we have one question. So from Rihanna or
Hi, good day, everybody. Thank you for taking my questions. Well, more like a response into the question that you asked. Personally, the reason that I highlighted the healthcare was not specifically because of just the pandemic, but the effects that it had because of the way that, I'm from Trinidad and Tobago, by the way, sorry. The way that persons' lives had to be adjusted, and the things in terms of the infrastructure and the structure of the cityscape denied access to green spaces. It denied access to healthcare facilities, and it greatly affected mental health because of it. In the way that the infrastructure and the format of the city, the walkability and the transport system that is currently lacking within my country has caused the architecture of place itself and the sense of place during the pandemic to become lost. And so I highlighted the health center as possibly being a place where they could have developed the area more and done more of the landscape usage and incorporated persons' daily lives and and also being able to access hospital use, because I mean, persons who suffered with diabetes and things like that just couldn't access the healthcare system at all. They couldn't go outside and walk to exercise and things like that. And then they were also limited to a certain time zone in terms of getting medication, and all of these things that of course had a roll-on effect. So I think if it was possible at all for them to reevaluate in my country the effects of the healthcare that then branched off into the other aspects of persons' lives. Yeah.
Okay, thank you.
Jump in, Adam, sorry, may I jump into this question or comment?
Yeah, of course, yes, your turn, please.
Thank you, Rihanna Bain. It was very important comment. I think it is, I can also support your argument that we have to think about more including of green spaces into hospital architecture. So, and that's why I wanted to show you some historic examples, because it was evident for them to have green space along with the hospital architecture that belong together. So I think we have to learn from this. And the second thing is, and it's not our topic today, but I also was thinking about the problem of decentralization and segregation in the city. So who has access to hospital architecture, or who has access to green spaces? There's a wide field, I know, but I think, or thank you very much for your comment, because it belongs together to our belongs to this conversation we have.
Okay, may I try to answer the question from the chat, because thank you very much for the question. And I think referring to the general idea of okay, can we try to find the healthy factors? Yes, I think this is one of the most important elements of our initiative, that we working together on different levels and different topics, and all of us is trying to find some let's say healthy factors. These factors can be used not maybe everywhere, because we have a countries with a completely different climate, different history, different, I don't know, different nature, and different people behaves, for example. But if I think this, let's say, the general healthy factors have to exist in many countries, and so I think that it's necessary. I think this is why our initiative should give us the possibility to find some, let's say, maybe not the one language, by some like parallel path for understanding each other in this topic. So I believe that one day we can find it, because without this sharing the knowledge, without these connections, as Mohammed said many times during his presentation, so it won't work like in this way. I hope that the answer is clear enough. If not, I will try to do it once again.
There's a question. I see a raised hand.
Yep, it's me.
Yeah. Hi.
First off, thank you so much for the presentations. I have a question about the second presentation. So you mentioned the pavilion system and the hospital in Vienna, right? But for instance, like in the second example, in the first example of the hospital, it seems like a bit gated, so that it's not really inclusive, let's say, to the general public. Maybe the pavilion system would be more of a development of that system, but how open is it to the public? Because I think that maybe interaction with the general public would be healthy or good, depending, of course, on the patients themselves. Like what kind of disease do they have? Yeah. And for your question about, like, can we overcome the machines for healing that we have in the conventional hospitals? I think it might come to the regulations, like the authorities and their regulations. And of course, like, we as architects and young planners, we do have like a responsibility in that as well. But like it mostly comes down to the regulators themselves. This is what I think.
Yeah.
Thank
you. I can only thank you very much. I can only answer your first comment or question. How open was it? Well, your observation is correct. The first example, like the 18th century courtyard system, in this case, and I think in many other cases as well, it was not open to the public, because the ambition was to keep the patients away from the public. So this is why it looked like a prison in a way, and it's closed. So you were not able to enter the courtyards, or you were not able to enter the architecture at all. They thought they have to keep away the sick and the ill from society. This is why it looked like a fortress. Your observation is correct. And the second example, the pavilion system, may offer a little bit of freedom or openness, but in the end, it was dependent on the type of hospital you have. So hospitals for the mentally ill, for example, were closed all the time because, yeah, they try to isolate the patients, and also with contagious diseases, as I said. But you're right, the first one was very closed towards the city and towards the society. There's another hand, please. Jay.
Hi, everyone. Thank you so much, first of all, for this very insightful presentation. And I have a question for you, Oliver. So actually, I am in healthcare architecture since a long time. And right now I'm working on evidence-based design, which is very prevalent in healthcare architecture. And whenever we design or I do master planning, generally we will go back to the history, how it all started. And that gives a very much insights and very much interesting ideas and concepts. But my concern or my problem is, before, communities were part of the hospital, and now it looks like hospital is very much caged in its own way. Basically, it's not very interactive. Even if you see, in your presentation, we saw that hospital corridor, right? It gives you very disturbing vibes. I would say it's not positive vibes. But if you see the old historical hospital-like spaces, because they don't call that a hospital, they are saying those spaces as a healing space, healing communities and those stuff. So how as in like young architects like us use that knowledge today's world and make the healthcare environment more impactful for the people?
Well, it's hard to answer how you should do it, but I think my aim today was to show you that it's worth to look at history, as you do already in your practice, as you were saying. So I'm arguing for a more holistic approach to this wide field of hospital architecture. So you take care of the place and take care of the history and stuff like that. But in the end, it's very individual and every site is specific. So I cannot really give you a satisfying reply, I would say. But I would like to ask you, what is the response when you do this research on the place? So your commissioner, are they interested in this, or are you doing just for your practice? So what is the response on your?
So evidence-based design is basically asking people what they want. So before, it is just like, about, what kind of room do you want, or only patient room has a natural light and stuff like that. But we have seen during our practice that staff is not satisfied by their work. So because of the less staff satisfaction, you see there are many problems and many stuff. So right now, this approach is all about ask everyone who uses that space or who are the end users and look through the history, how they dealt with those things, and you can implement those things in today's world. So basically, for example, this pavilion you mentioned. So right now we are out of space, I would say, out of land. So making a pavilion is very hard. At the same time, it's very the cost will increase like so much. So at what extent should we follow and how should we follow? But your examples really helped me a lot. So thank you so much for that.
Thank you for your comments and questions. Thank you.
Yeah, okay, thank you very much for the question from the chat about the greenery. So I think yes, yeah, it's a quite difficult problem if we talk about the city with a high density. But of course, how to say, if we can try to add some more greenery to that kind of structure is always useful, yes. But I think the problem is with the maybe I shouldn't say that, with the local authorities and also with the local planning. A few years ago, I was teaching online in India, and so we talk about some kind of let's say high-rise development of the some little part of the city of India that's not important. But of course, the closes of the building was horrible experience. So thanks to this, it was quite difficult to live, because the people can let's say shank their hands from the windows. It was amazing. Let's say very unpositive experience. So it means that the problem lies with the planning, in fact, because this density comes from the planning, from the local authorities, and from the, let's say, the local business, which is responsible for such kind of let's say risky living. In fact, I hope that the answer is good for you, or should I add something more? Okay, Oliver, maybe you should start.
Thank you, Caitlin. Very good question. I mean, it's interesting to see that WHO uses a concept of health that is very holistic and that includes the body and the mind. And so being healthy is also having a social fulfilled life and a good connection to your community and stuff like that. And I think we should embrace this conversation even more with architects and planners, and also with doctors. I don't know, because I'm not a practitioner, but I was wondering if what you're saying here, if this problem could be overcome if we include more dialogue in the planning process. I don't know if this is possible, but when I was researching my topic, I saw that in 19th century, doctors of medicine were very engaged in architectural conversations, and they published a lot. So if you read through the journals, medical journals, you see a lot of papers on city planning, on housing, on hospital planning. So there was a really interesting conversation in the 19th century between doctors and architects. It was very on the same level, I would say. So maybe we can create an environment that enables this conversation again.
Okay, so from my side, I think this mental health is very important. I didn't talk about this, but I think, in my opinion, it's one of the most important elements in today's time, because after pandemic we still have a lot of mental problems, but of course, without this let's say knowledge and the sharing among the architects, spiritually, I really appreciate the architects who used to try to talk about these mental problems and how they can try to share it with architecture, because normally during the design process, we don't think about it. Maybe I shouldn't say that, but we don't think about it, because for let's say for many of us, the most important is the shape, the idea. How can we present this? How it will be, let's say, promoted among the public, or if it's going to be any, let's say, positive response from the critiques, for example. But somewhere deep in this architecture, this mental health is necessary, for sure. So Kathleen, thank you very much for asking this, and I feel a little bit ashamed that I didn't talk about it too much. I'm sorry. I will try to do my best maybe next time. Thank you.
And Adam, there's another question in the chat that goes maybe to you as a practitioner. What could be the design approach of a healthy city or town or conventional hospital in a context where getting minimum health treatment is a luxury? That's a very good question, but difficult to answer.
I know. Yeah, that's right. Okay, let me think. Yeah, it's okay. Speaking truly, once again, I would like to come back to the planning as one of the most important point. For example, when I look at the Polish market, so the greenery, especially among the contemporary multifamily houses, is going to be a luxury, in fact, because the private investor wants to earn as much as is possible. And example from my, let's say, from my, no, maybe from my practice, but from my place when I live, not so far from my home, there was a small forest, about 5 hectares. All the trees were cut down because the city changed the master plan from public greenery into the housing. And so at this moment, it's amazing. It's very awful architecture surrounded by the other blocks, and so this is the problem. Yes, the greenery is important, and of course, the greenery shouldn't be treated as something which is expensive or some kind of luxury. It's needed. When you turn back, for example, to Vienna cases, there are the thousands of examples from of the architecture from the beginning of 20th century or at the end of 19th century in Vienna, for example, in Germany, when this greenery was treated as one of the, let's say, like as an added value to this architecture. Yes, and also the hospital, the Oliver presented this one with the pavilions. The pavilions were located among the greenery because it was treated as a healthy. It was something like introduction to the modern movement discussion how the healthy architecture should look like.
Yeah, there was a very broad discussion about the role that greenery also played as a social factor, but also as a healthy factor. And again, this was a very dynamic conversation, and I think that this is necessary to include all the elements. And as you said, Adam, greenery is not an addendum, or it's not a luxury. It should not be a luxury. I know that's a luxury in some parts, but it should be a significant and integral part of the whole planning process. So it's not like, okay, we have a hospital now, and then we need some green space around it, but it should be more integrated approach. As a theorist, it's very easy to say, and I know that it's hard to realize it in practice, but we should keep it in mind at least, and be aware of the problem.
Okay, so I also can see that there was a question from the chat about the verticality in designing hospitals. Maybe Oliver, maybe you start from this, and I will try to add something from my side.
Yeah, thank you for the question. I mean, my examples were very horizontally, and I could also show you vertical hospitals like these machines for healing. But I would say it is in terms of a healthy environment and of air and the greenery and the access to landscape, which I stress so much. I think that vertical planning is very difficult. I understand that in a very dense city environment, you need to go up because you don't have the space. But historical solutions show that the hospitals tended to be horizontally organized. They understood that you need to do it like this. And the question was, yeah, is this a useful conceptual reorientation? Yeah, I think so. But again, it depends on the local context. Sorry, I give you always the same answer, but that's the way it is.
Yeah, I'm totally agree with Oliver that, for example, when you try to design some buildings as a hospital, so this I think I really love this idea with the pavilions. So of course it was also very popular in architecture of the 50s and 60s. But of course, in a different way, it was some kind of connection between machine for living and machine for production, let's say the healthy people or something like this. But of course, this landscape, this landscape way of designing the hospital is much more interesting, and of course, it helps to people to recover, let's say, faster. Yes, okay. You put somebody into the box which has which consists of, I don't know, 20 or 25 floors without any greenery. Of course, we can add some green things inside, but it's not like this. It will be always some kind of like a substitute of this connection between the healthy recovering and hospital in the landscape position. Guys, do you have any other questions? So I would like to, if not, I would like to come back to the questions you sent to us, or you try to answer. You talk about some kind of, some of you talk about the local point of view. Do you think that this local point of view of designing the healthy architecture, healthy city, salutogenic architecture is a good idea to think about the local environment, or do we have to try to find some, as we talked about it earlier, some kind of, let's say, like a pattern, like from the modernity that, okay, we have a box, and the box means hospital, a crematory, school, house, or something like this? Or can we try to play much more with a local environment? What do you have any ideas about this, ladies and gentlemen? Any ideas? Okay, yes.
Okay.
Yeah, we have
So I think
one.
it's useful, of course, to have it locally oriented. We can, I mean, some global examples can be useful as well, just to have an idea of like how others had like their different solutions. But at the end of the day, when you're trying to, for example, like having plants and things like that, you have to look at the local solutions. Like you can like global solutions can be beneficial, but at the end of the day, when you're planting, it has to be local. Even like the type of architecture. For example, in some countries, they prefer more privacy. So in your planning, it has to be more private as well. So it's not just about the plants, it's also about like the social aspect, the political aspects, and all of those things, they have to be considered.
Okay, so
Yeah, just an idea. We talk about medical progress in the 20th century, so the development of new kinds of medicine and treatments and drugs. I think this led to the tendency that you see the patient as isolated from the environment. So you put him in a box, gave him the right kind of pill, and then he will become healthy again. So that cut off all the environmental aspects of health. And I think that COVID has shown that this approach is kind of problematic because it leads to all the problems we have. So maybe COVID also reshaped our thinking about health as a concept that includes the environment and nature and the social life. That is very important, and it was always the case in history. So maybe COVID has also, in the end, maybe something productive and constructive for our conversation.
Yeah, exactly. I think like COVID, like after COVID, we started to learn more things about like how we need to like enhance our planning strategies and things like that, especially when it comes to like having more space, like more green space, like the space for the individual and things like that. Yeah. And by the way, I have also a question regarding when you say green spaces, like it doesn't necessarily have to be green. Like you can just say like natural spaces, because in some countries you have the local plants, like they're not necessarily, or like the predominant aesthetics of the place, they're not necessarily like predominantly green.
I mean, you mean
Sure.
desert?
This is like a useful comment.
Yeah, the color.
Okay, yeah, of course, yes, of course. This is okay. Green, it's just like a word. Yes, we talk about the accessibility to some open landscape. Okay, yes, of course, we can also talk about the for example, the desert as an open landscape. I'm sorry. Yes, I forgot that we have a participant from completely. Yeah. Okay. We have a question from John also on the chat, Oliver. So would you like to start to
The global versus local? I'm better a localized perspective. Is this a question or a comment? I'm not sure. It's a useful thing, but maybe you can explain a bit more. A comment. Okay. Yeah. Localized. So you mean this is a synthesis of local and global? Yeah, you could. It's a term. Yeah, it's a good term. Yeah. Can you use it?
Okay, it was a comment. Thank you, because I was afraid that Joanna is cheating us a little bit, and she's checking how big is our knowledge about the globalization and some other aspects. Okay, thank you, Joanna, for it wasn't a joke. It was just a comment. Okay, so we have okay, we also have another question. So wow, but this is the question which talk about the, let's say, much more about the hospital environment and how they should. Maybe Kathleen should change. Maybe Kathleen will help us.
But it's also a question of health communication and health education, I think. Maybe a workshop topic. Caitlin,
Yeah, it's a good idea. Mohammed, maybe Kathleen would like to add something from her experience.
Well, no, I'll just say I want to keep the spotlight on you two, but so the question I received is sort of, if people are getting proper like health and mental education at an early age, will this help sort of reduce pressure on hospitals? And just to say that part of the goals for the conversations that we've been convening as part of the epidemic urbanism have been trying to sort of think about, okay, what are the problems we see now? Like what led us here? And then what do we do in the future? So I like that we're sort of thinking systemically here to sort of say, we need to learn these deeper lessons, right? We're suddenly seeing this mental health crisis. It's been there all along, but now we sort of have this renewed focus. And so what do we do? How do we finally take these lessons seriously? So it's not really an answer, but I guess just to say, I appreciate the question here. And this certainly came up in recent conversations we had about architectural pedagogy in particular, right? How do we really pay attention to the whole person? If we're going to be designing for whole people, how do we sort of pull that into the educational design process too?
And I could not ask for a better kind of concluding session for the workshops that we had, because we started this whole thing with planning, design, and these concepts, like, for example, resilience, right? And then we talked about environment, and I'm really happy that both of you talked about this concept of healthy city, and especially Oliver kind of concluding with hospital design, because now we know that health is not about hospital. Health is way broader. Hospital is at the end of this kind of circle, right? And if things are not working, if if there is no kind of social public awareness about many of the topics that our colleagues discussed before, for example, waste management, and how I, as an individual, deal with waste in my household as a responsible person, because I'm really happy that we discussed many of these things, that we should not leave things to governments or to agencies or architects. Every one of us as individuals can take a step to address this issue of kind of global health.